But again, welcome to the FFPS Town Hall. Milestones Matter, celebrating the FFPS benchmarks. We're really excited that you all have joined us today and joining to learn more about some FFPS program updates and being able to hear from a couple of counties as well on how they are moving the work forward in the Family First Prevention Services program. My name is Derek Slama. I am the Prevention Program Director with the Child and Family Policy Institute of California, or otherwise known as CFPIC, and joined here with our California Department of Social Services colleagues who will also be leading in the presentation today. And so just a couple of housekeeping items as folks roll on and join. This is in a webinar format. As I mentioned, this is being recorded, so we will share the recording, which will be available on our webpage at cfpic.org. But for today, for the interaction portion of this webinar, we are hoping that folks can utilize the Q&A feature that you'll find at the bottom of the screen with a little question mark in the box. You'll be able to drop any specific questions you have about the presentation and or the content. So utilize that if you have questions about program components, anything that's maybe discussed. And then if you have any specific feedback, or there might be certain points along the way where we might ask for you to share a little bit more as we did with your introductions in the chat, feel free to use the chat feature at the bottom of the screen as well, or you'll also see it on the side of the screen there to share any feedback or connect with others as we move along today. And so really the purpose of today and the purpose of the town hall is we want to make sure bringing to you all, communicating and clarifying all of the key updates and the resources related to the Family First Prevention Services program that really impact everyone involved in comprehensive prevention planning. So whether you're a community-based provider, whether you're a tribe or a tribal organization, a county agency, probation, child welfare, or even just technical assistance provider or other statewide partners, this really is for you to get those updates, hear about what's happening within the program, and engage with us on any questions that you might have and that we can bring back and follow up with over the coming weeks as well. And so today, what we're going to be covering is, we started our welcome, kicked that off. We will also be sharing some FFPS program updates. So I'll shortly turn it over to our CDSS colleagues to share some of those program updates. We'll also have a brief presentation on the pathways to prevention services. So talking a little bit about what are different avenues a family can access prevention services locally. We'll hear from a couple of counties. We are very excited to have San Francisco County and Kings County join us today to talk about their process and how they're approaching these topics. And then we'll jump into then nailing down a little bit more into the local process of candidacy determination. What are some updates and some guidance and materials and resources related to candidacy determination? Hear from those counties again on how they're approaching that. And then we want to make sure to close out today with talking a little bit more on how you might be able to get involved and share progress and be able to interact and engage with us ongoing. And then we're going to talk about what's coming next. So there are a lot of resources and materials in development, and we want to make sure that we bring that all to you and keep you aware of what's coming down soon. And then I will talk a little bit briefly about today's objectives as we talked about the agenda. So again, this is celebration of milestones and those FFPS benchmarks, and we're all moving quickly over the next year to get to the point of rolling out the FFPS program. And so in celebration of those milestones, we want to identify what those program updates are, the available resources, as I mentioned. We want to identify updated information, hear directly from counties on their progress regarding candidacy determination, and then all of the different avenues and ways in which a family can receive a family well-being plan or prevention plan to receive those 4E funded prevention services. And then, of course, we want to explore ways with you all to get involved and resources that are coming next as mentioned. And I see that there, and I do know that folks have a raise hand feature. So if you have any questions or if you have any comments or feedback, please feel free to drop that in the chat or the Q&A if you're posing any questions, just to make sure we can get those responded to, as this is in a webinar format today. And so what we're going to start with is we have a brief poll just to, again, I thank you everyone for dropping in your information in the chat, but we want to get a pulse on who's here today. So who's joining us? So what's your role within comprehensive prevention planning? Are you a CPP lead, either through child welfare, probation, or the tribe? Are you a service provider? Are you a statewide technical assistance provider? Are you a training provider? Or is there some other way in which you're involved in comprehensive prevention planning that's not reflected here? Please share other and then drop that in the chat. We'd love to hear your role within that and who's joining us. Awesome. Thanks, Wendy. County partner, lived expert. Thanks so much. Great. Welcome, Erin. We have a teacher, Martha. Thanks so much for joining us, Martha. Definitely important education partners to join us in this comprehensive prevention planning effort. So we have about almost 70% of respondents, so maybe give it just another 15 seconds for folks to respond. All right. We are at 75%, so we can go ahead and close that and share that. So it looks like we have mostly service providers, as well as child welfare CPP leads in the room joining us today. We have some TA providers and training providers, and then others, as they've mentioned in the chat. So so glad to have such a diverse group joining us today as we delve into all of the CPP work. And so with that, I think we will go ahead and move on. I'm going to introduce Kelly Winston, who will walk through some of the FFPS program updates. And so I will turn it over to you, Kelly.
Thank you, Derek. So welcome, everybody. It's really great to have you all here with us today. I'm Kelly Winston. I'm Chief of the Safety and Early Intervention Bureau here at CDSS. I'm part of the FFPS leadership team representing CDSS today. So in the spirit of celebrating all of the benchmarks we've accomplished since our last town hall in July of 2025, we wanted to give you some updates. And yes, while milestones matter, we also, I promise I will do so quickly so that we can move on to all of the great resources and opportunities we want to share with you later today. So first off, speaking to September of 2025, wanted to share with you the release of the FFPS motivational interviewing training plan. This is a fact sheet that we have shared publicly that details all of the minimum training requirements for the FFPS program for delivering motivational interviewing for 4E reimbursement. So this is going to detail all of the trainer qualifications, the core content and coding and coaching requirements that you'll need to have in place in order to meet fidelity, which will help support claiming. At the same time, this MI fact sheet has also been released to clarify the specific avenues for potential access to MI training, and you can find both of those documents on the CFPIC website. Moving on to October of 2025, sharing that Chapin Hall and CDSS, in coordination with our FFPS Advisory Committee, has finalized and published our CQI implementation plan. So this plan details all of the specific activities that counties and your partners and your CPP teams will need to have in order to deliver 4E funded prevention services and all the requirements related to to meet the CQI requirements. And then moving on to November of 2025. So here we just had a little bit of a shift in the program, recognizing our need to meet priorities urgently by October of 2026 when CARES comes online. We did a little bit of restructuring of our advisory committee structure. And this was really to ensure that we're tracking all of the guidance that we need to get out and all of the different elements of the program that have to be in place for claiming to be able to happen when we go live in October. So in addition to that minor restructure, we also added a fiscal work group to our subcommittee structure to address all things related to fiscal matters, and we'll talk about that in just a minute. And we'll share a little bit more about how that fits into the new structure. And then finally, coming full circle today to December of 2025, we are going to talk a lot today about the resources that are coming out pretty quickly, and then those that are also in development that we want to share with you, along with more information about considering candidacy determination and the ways in which we engage families in the development of their family well-being plan, also known as a prevention plan. Next slide, please. Okay, as previously mentioned, we really just needed to address mission critical objectives to ensure that we have everything in place for counties and tribes to be able to claim federal 4E once we go live in October. In order to do that, we wanted to think about how we phase our approach over the next year, and so that we can establish an infrastructure that focuses on utilizing our infrastructure for evidence-based practices to set up those building blocks that will help us in future development for the community pathway. So setting up that infrastructure is part of phase one. And then I just really want to share with folks that while we are focusing on the EBP implementation at this point, we want to be really mindful of what that looks like and how that impacts our development of the community pathway. So while all of that is great infrastructure building, we know that there are going to be some things that we have in common or that we need to be mindful of as we're developing those building blocks that support community pathway development. So while there is a phased approach, it's also very parallel in ensuring that we do what we need to do to make sure that the program has the steps that need to happen in order to support ongoing and future development beyond what is those 10 EBPs. So moving on to phase two, we are working on that infrastructure development for Title 4E claiming. Those limited services at this point look at the larger service array and how to create an integrated network of services. This might be exploring how to blend and braid funding, looking at how to leverage other initiatives while developing resources and guidance on how to create that seamless community pathway across networks and how those pathways work together to ensure that families have that no wrong door approach. And then looking also at other promising practices for future consideration in the state plan. And then phase three involves looking really more about that long-term sustainability. So how do we sustain prevention programs long-term over time? What does that funding process look like? What other initiatives and teams are available to help support the ongoing structure of the program? How does that fit with things like CalAIM, for example? And how does all of that work together again for that no wrong door approach? So this may look at future evaluation opportunities for programs and again, additional services within the prevention plan that help expand our community pathway service array. Next slide, please. Okay, a little bit more as promised about the establishment of the fiscal work group. This is definitely in alignment with our phasing process. The fiscal work group involves county program staff, providers, tribal representatives, statewide associations, and other state partners like DHCS and CDPH. The purpose is for us to convene a diverse group of partners with expertise and a vested interest in fiscal claiming and sustainability, both for the FFPS program and for the community pathway. So with the goal of addressing administrative and service claim issues, we also want to be able to clarify payer of last resort guidance and explore opportunities to expand prevention services that support that long-term sustainability of community pathway infrastructure. Our first priority for the work group is to focus on claiming and data collection. So this priority will help us develop and publish clear roles and responsibilities for data collection and claiming between the Title 40 agencies and providers, including resolving some outstanding claiming questions and concerns that we've been hearing about for the last couple of years. Priority 2 for the work group is local blending and braiding. So this is an opportunity for us to develop guidance for counties on associated requirements and provide clarification like options or examples for how best to blend and braid funding to support prevention efforts. And then priority 3 is long-term sustainability. So how do we identify and share opportunities to leverage other funding sources? Again, for example, CalAIM, CYBHI, BH Connect, and then, additional other programs that can help with sustainability of the community pathway. And so that we have those long-term prevention efforts underway. So this fiscal work group has been hard at work since October, and we've been meeting every other week to address issues specific to claiming and data collection. And our next meeting is scheduled for December 15th. Okay, with that, am I handing it back to you, Derek?
I think we're gonna hop over to Michaela to share a little bit.
Thank you.
But
sorry.
here we can, no, that's okay. And just sharing a little bit, I think, just about the fiscal work group's current focus of identifying and clarifying those, I think, as Kelly mentioned, those specific roles and responsibilities when capturing data and cost information and developing some recommendations for creating FFPS administrative rates. So that fiscal work group is really getting into the nitty gritty of looking at some of those outstanding things that counties and providers and tribes might need to learn a little bit more, understand, or identify as they go into different contracting processes for prevention services. So with that, I'll pass it over to Michaela.
Thank you, Derek. Good afternoon, everyone. I'm Michaela Van. I work under Kelly Winston as the researcher for the Safety and Early Intervention Bureau. And I'm going to go over a little bit about CQI and the resources that are available, but we're going to start with a reminder of what the state requirements for CQI are. So under WIC 16587, all Title 4E agencies and tribes with a Title 4E agreement must implement a CQI improvement framework. So this framework must be developed in accordance with CDSS issued guidance, as well as support ongoing monitoring and improvement of prevention services, and use data-driven strategies to enhance service quality and outcomes. And this is, of course, because CQI is a foundational requirement for all prevention services under FFPS and ensures accountability, effectiveness, and continuous learning across the systems. Can we have the next slide, please? Thank you. So these are the available resources that are shared out currently on the CFPIC website, and I'll just go over them a little bit quickly. So the first is California's CQI plan, which outlines the state's vision for using data to improve outcomes in child welfare. It emphasizes a structured, cyclical process of assessment, planning, and implementation and evaluation. And the plan ensures alignment with federal requirements and supports local capacity building. The next is California's CQI implementation plan, and the implementation plan provides practical guidance for counties and tribes to operationalize CQI. And this includes timelines, roles, tools, and technical assistance to support local implementation. And the plan promotes consistency while allowing flexibility for local context and needs. The next available resource are the EBP briefs. So the evidence-based practice EBP briefs summarize key information about approved prevention services, and they include descriptions, target populations, implementation considerations, and evidence ratings. And these briefs help counties and tribes make informed decisions about service selection. They are almost all complete. I will say that the motivational interviewing brief is almost ready, so that should be released probably within the next few weeks, hopefully before Christmas. And finally, the EBP outcome and fidelity report templates are almost all complete as well. These templates support standardized reporting on service outcomes and fidelity to the EBP model. They help agencies track effectiveness and ensure services are delivered as intended. And these templates align with the state and federal evaluation requirements under FFPS. So again, motivational interviewing, that is also being finalized and should be available shortly. And now I'm going to pass it to my colleague Stephanie, who will go over some information about candidacy.
Good afternoon, everybody. Stephanie Berna in the Early Intervention Services Unit. So going over the candidacy and service pathways brief, the purpose of this brief is to provide clarification on the candidacy determination process, considerations in this process, and example scenarios. So there will be examples provided as well. Just know that this is in its first version and a draft form, so additional feedback can be provided and changes can be made to those examples, and additional examples can also be added within the brief. So the brief provides clarification on ways a family can be connected to a family well-being plan through various service delivery plans. Next slide, please. And now we'll go over the pathways to prevention. So how will California services be delivered? They'll be delivered through two pathways. The 5-year prevention plan outlines the two pathways for delivery of services. And one is the Title IV-E pathway. This is a more traditional pathway for delivery of services. The families served in this pathway have generally already come to the attention of child welfare or probation through family maintenance, either voluntary, court-ordered, or after reunification has occurred, but when services are still needed by the family. These can also be juvenile justice cases where the youth is subject to a 602 petition, and there is imminent risk of entry into foster care. Also, these may be referrals that come through child abuse hotline during investigations or through probation referrals. And this pathway offers services for children and family members. These services may include non-Title IV-E eligible services, and this pathway offers an opportunity to improve upon those traditional practices and improve success rates for the families served. Lastly, in the Title IV-E pathway, the oversight and case management is completed by the Title IV-E Child Welfare Agency. The community pathway, in this pathway, FFPS gives the opportunity to improve upon family maintenance services. So case managers can better engage families, provide higher quality services, and focus their efforts on services and active and reasonable efforts that meet the cultural needs of the family served. So again, these are services without stigma. Families can self-refer or be referred by another community member, such as a school personnel or physician. And while the determination of candidacy must be made by the Child Welfare Agency, services can still be completed through community-based organizations and without any other child welfare involvement from the family's perspective. And again, child welfare and state oversight is required, but this would be done behind the scenes. Next slide. So how do families get to services? Again, they may access prevention services via one of the two pathways. And how do they receive services? So once the family accesses the services or the service array, prevention services may be provided via a family well-being plan. developed by the Title 40 agency or by a community provider. So based on the agency or organization developing and monitoring the plan with the family, they will receive one of the following 3 voluntary service delivery plans. In the Title 40 pathway, those plans include the Title 40 agency combined plan. And this is for families with an open child welfare case or ongoing involvement with the probation department. The second is a Title 40 agency prevention only plan for families with no open case or referral with the Title 40 agency. And you can reference the last bullet under community pathway. And this is the community pathway plan for families receiving services via the community provider. So no involvement with child welfare or probation. Now, Stacy Kinney, the Chief of Family-Centered Safety and Support section, will provide an overview of each plan.
Thank you so much, Steph. Hello, everyone. Stacy here, as Steph just mentioned. So I'm just going to go over the next couple slides. I'm just going to go over the different plans that fall within those 2 pathways that Steph mentioned. So the 4E agency combined plan, this plan applies to families with an open child welfare or probation case who are also receiving Title 40 funded prevention services. So this is going to include families with voluntary or court-ordered family maintenance cases, probation-involved youth, and expectant or parenting youth in foster care. Some of the key criteria for this plan is there is an open case with the 4E agency. So this would be county child welfare, probation, or a tribe with the California 4E agreement. And the 4E agency develops and monitors the family well-being plan with the family in this plan. Next slide. For the 4E prevention only plan, this applies to families who are voluntarily seeking prevention services and have no open child welfare or probation case or referral. So these families receive services directly from a 4E agency, typically in situations where the community pathway is not available in that county, or there's no community providers able to offer the case management for those prevention services. In these cases, the 4E agency has dedicated staff who coordinate and deliver the necessary support to help mitigate any imminent risk to foster care placement for these families. And some of the key criteria within this plan would be there's no open case referral or case held with the 4E agency, probation, or tribes with the 4E agreement, California 4E agreement. The services can be provided within the community by community-based providers or the Title 40 agency or a combination of both. And for this plan, the 4E agency develops and monitors the family well-being plan, again, in partnership with the family. And for our last plan that we have, next slide, is the community pathway plan. So this plan is going to apply to families who are receiving those community-based prevention services with no involvement from child welfare or probation. So the families can be referred by a 4E agency after a closed case or referral, or they can self-refer or be referred by other community partners directly to a community provider. Again, the key criteria within this plan is that there's no open case referral or services from the 4E agency, and the community provider develops and monitors the family well-being plan in partnership with the family as well. Next slide. Right, Derek, I will hand it over to you.
Thanks so much, Stacy and Stephanie. Thanks so much for the overview, and folks can check out that brief that goes into really in-depth detail of each of these pathways, specific examples and scenarios within the brief itself, within each of these different service plan avenues. And so we want to, before we get into having a conversation with some of the counties that have joined us today to talk about how they're approaching this pathway, these different pathways, we wanted to do a little activity so to get you all thinking about these different pathways and the plans associated with those pathways. And so we're going to start with this first scenario. We have 2 scenarios. The first one here I will read aloud, but feel free to read there. A family has a child welfare referral, and through the emergency response process, they are offered and are interested in prevention services. There are no community providers in this county that can provide case management, but the county has prevention service staff who can develop a family well-being plan and provide a 4E funded prevention service. So one of those evidence-based programs within the state plan. The allegations were found to be inconclusive. The referral is closed, and the prevention service staff worker works with the family. Based off of this and the descriptions that I know Stacy and Stephanie went through and is within the brief, what would you say this pathway involves? And so keeping in mind that ultimately the pathway that will be determined is based off of who is developing and monitoring the family well-being plan with the family. So take a few moments. See which service plan would you determine? So I see we have a few folks that have started to share their thoughts. We'll give it a minute. All right. Yes, and go ahead and just address scenario number 1 that is on the poll. Sorry about that, folks. So scenario number 1. Which pathway service delivery plan would this scenario involve? All right, and I think we are getting up to getting a set of responses here. So I think we can go ahead and end the poll. And then go to the next slide here. So this would be, since this would be specifically the prevention service staff worker that is with the 4E agency, this would be the 4E agency prevention only service plan. So this would be one of those voluntary plans that would be completed with the family. The family would be determine if they would like to accept any evidence-based prevention program service that is 4E funded or reimbursable through 4E funds, and work with that prevention staff worker within the county to receive the services and support through that family well-being plan. So this, since it would be developed and monitored by the 4E agency, this would be that prevention-only service plan. All right, and so for the next one, and I'm wondering if there's a way to relaunch that poll. So we're gonna go ahead and relaunch that poll here and go ahead and complete the scenario 2 based off of which pathway service delivery plan this scenario would involve. So I will go ahead again and read this one here. So a family has a child welfare referral, and through the emergency response process, the emergency response worker does not substantiate the allegations, but identifies that the family system is stressed by unemployment and financial strain. The emergency response worker had also learned that the child has a sibling in foster care. The father had prior child welfare involvement and did not reunify with this child. The family is offered and is interested in community-based prevention services, and the emergency response worker refers the family to a provider out in the community and closes the child welfare referral. After the referral to the community agency, the child welfare agency does not receive any follow-up information to confirm if the family followed up with the referral to services. If the family followed up, the community provider would make a de-identified candidacy recommendation to the 4E agency. And if that candidacy determination is approved, they would develop a family well-being plan and provide services to the family. No, that's a long scenario there, but hopefully folks can think through that, see what would you say, and we're going off of the scenario 2. I know you might have to complete both to submit, but we will go ahead and work off of scenario number 2 to determine how you would determine this pathway service plan. give folks a few more minutes or a few more seconds here to determine that. We'll give it about 15 more seconds. Again, remembering who is developing and monitoring that family well-being plan with the family. All right, and we will go ahead and close that poll. And we can jump to the next slide there. And so this would be that community pathway service plan. So ultimately, the family they were referred to child welfare. It was not substantiated. It was closed. It was referred out to a community provider. And in the spirit of the community pathway, the provider will work with the family. They'll do the candidacy determination, make a recommendation for candidacy to the Title 4A agency, so Child Welfare or Probation, or the tribe with 4A agreement. And after that is approved, they would provide the services. So this is otherwise no interaction with the 4A agency. And so we will jump to talking a little bit about these pathways with counties and how they are actually approaching it. And so I am super excited to have our two counties joining us today, San Francisco County and Kings County. You'll see here on the slide, San Francisco County pathways, and they'll talk a little bit more about each of diving into those pathways or those plans within those pathways to how they're approaching family well-being planning. And you'll see that for both of those counties. But I will start by introducing our panelists here. So first, I will start by introducing Denard Ingram, who is with the San Francisco's Human Service Agency. And Denard is the Program Support Analyst and Comprehensive Prevention Planning Lead in San Francisco, and is specifically with the FFPSA and Strong Families and Communities program. So thanks so much for joining, Denard. And then also Natasha Endres, who's with Kings County, who's joining us today, who is the Child Welfare Services Program Manager with Kings County Human Services Agency, and is also a Comprehensive Prevention Planning Lead with Kings County. Welcome to you both. Thanks so much for being able to spotlight all of the great work you all are doing, and excited to also share that Denard and Natasha are part of our 4A advisory subcommittee within the FFPS advisory structure, who are also working with us closely on figuring out all of the details to how this gets implemented as well. So thanks for joining. I am going to start with Denard and asking in respect to San Francisco County, and then we'll jump over to Natasha with Kings County as we move through some specific questions. And so Denard, if you can start out by sharing a little bit about which pathway your county plans to implement and what really key factors informed and went into the decision-making for implementing that specific pathway or pathways.
Yeah, for sure. Thanks, Derek. So in San Francisco, our primary pathway that we focused on is our community pathway. And a couple of things went into deciding on that. And I think the biggest factor is, so San Francisco has had a network of family resource centers. I think we have 25, 26 family resource centers that have been in place for a number of years, as well as some existing partnerships around prevention with some other community providers. So we've been able to really leverage that existing infrastructure to fold in the FFPS work and figure out how to expand that so that we can capture these additional 4E populations that we want to service under the FFPS work. So that really is kind of the foundation of our community pathway for FFPS. And because we already have that in place, really what we've focused on over the last, I want to say, year and a half, is how to implement a lot of the requirements that Stephanie and Stacy outlined for both state and federal, those state and federal requirements. So we've been able to internally pilot some of these things and work out a lot of the kinks and work with our community partners on, their readiness and assessments for, implementing EBPs, fiscal readiness, things like that, in preparation for the CARES launch next October.
Thanks so much, Denard. And I know that you all are really going expansive with your community pathway, really incorporating all of those, as you mentioned, all of those partners, the family resource centers. And I know you all have even been engaging in this really early of looking at the different pathways and how specifically community pathway. I know we've talked a little bit about how you all are looking at expanding some of these partnerships within your county as well to really create this integrated system within your community pathway.
Yeah, we started with solely focusing on our well, I should back up. I mentioned this internal pilot that we've been doing since April of last year, where we focus specifically on our referrals coming through the hotline that were evaluated out. So those are the referrals where there's a referral made to the hotline. It's determined that further investigation is not warranted, but that there's a recognition that family could benefit from some additional resources. And so we focused on those for this internal pilot of FFPS, which, as you mentioned, we call Strong Families and Communities here in San Francisco. And I think we've had about 470 something referrals that we've referred through this evaluated out pathway that we're connecting to FFPS work. We see about a 50% engagement rate with the community service providers. And it's given us some really great information in areas such as so we can see what part of the city the bulk of these referrals are coming from, right? We can see where we need to engage additional community partners to service some of the areas where we see referrals coming in. So it's really given us a lot of data to work with and how we can better kind of flesh out some of these other aspects of the implementation piece.
Yeah, I love that, Denard, and especially looking at that ongoing into implementation, all of that continuous quality improvement that you all are doing in the process. And I know, Natasha, with Kings County, you all have a different approach that you're taking to some of the pathways to prevention services. And so really excited to turn to you as well to talk a little bit about the pathways and plans that you're looking at, how you are looking at implementing those, what key factors. So same question of which pathways and what key factors inform your decision to implement those specific pathways.
Yes, so Kings is taking a different pathway. We are doing the prevention only pathway. And so initially, when the CPP was being planned, we did all of the things, the asset mapping, the needs assessment, all of those different items, and was able to identify our candidacy. And initially, we did decide to do the community pathway and put that in our plan. And then the work really began on figuring out, our community pathways, do they have the capacity to do this pathway? And so we had selected one of the EBPs initially because, you had to choose one. And so we selected one and then really started working with our providers in the community. And Kings is a rural community. We have one larger town, but everything is spread out. One of our towns is about an hour away. And so when really looking at the ability to serve this very high risk candidacy that we selected, we started to assess whether or not that community pathway would have not only the capacity to serve this population, but also retention is challenging. Are they going to be able to go to these rural communities and all of these different things to consider? And so last year, Kings did decide to pivot after consulting with RLT and CAPC and different stakeholders in what would be the best way to really target this high risk population. And so we did shift and decided to do this prevention only pathway. And we considered big picture, if we're going to start something, whether or not CARES comes out or anything, we want to be able to sustain this. And so when we were talking to our partners, the community pathway would have been a contract, and we would have had to ensure their capacity and all of these different things. And looking at the big picture, we said, we could ensure that we can continue to serve this population in this targeted preventative way. And so that was one of the things that went into our decision. Additionally, when looking at it, we did choose motivational interviewing as the EBP because it was something that we're not, all of our social workers aren't trained to do that currently, not across the board. And so it is something that we could really train up a team of social workers to target this population and not only provide this intervention, but also oversee the family well-being plan. And we could ensure, even though of course everybody has retention challenges, we could ensure that if the families needed to be served, we're going to make sure we're going to have the capacity to serve them. And so lots was taken into consideration, but after that shift last year and updating our plan over the course of last year and this year, we have really been able to unravel and see that it is the best choice because we are able to, we're beginning our pilot and really seeing how we can serve this population.
That's really helpful, Natasha, and to think through. I mean, because I think you all have really specific strategies in which you've been able to start thinking through implementing this prevention only plan pathway or plant service plan through the 4E agency pathway. And could you talk a little bit about how you all have, thought about and started planning for, I know you have like a specific staff member that's going to be dedicated to this. How are you approaching that, especially in relation to knowing the voluntary nature of this pathway and family well-being planning, and how you might be utilizing that in addition to, I know you all are implementing motivational interviewing as well, right? And thinking about this as a sustainable way for the larger workforce. Would love to hear a little bit about how you all are approaching that and how you see that maybe manifesting within your county.
Yeah, so with the prevention only pathway, we did identify that we'll have one social worker and one supervisor overseeing it. It's not fully rolled out, so picture perfect is that, and within our policy draft, our procedure draft, we do have a very clear line between investigation, ER, that whole realm, and this prevention. And so the way that the procedure is laid out, we haven't fully implemented yet, but that the investigation would come through, ER would do exactly what ER does. And then if it does meet candidacy and the family is open to it, then ER would finish their investigation, find a dispo, close it out, and then refer to that prevention unit, to which then that social worker would meet with the family, explain what this would look like, figure out if the family is really open to doing that, and then that's when they would, take off with the family well-being plan. So there is a very clear line drawn between the two so that it doesn't get blurred out. If there is concerns that come back up, new allegations that come back up, then it would flip right back to ER. ER would do their investigation, so there wouldn't be any kind of overlap. With regards to the motivational interviewing, we did decide, because we are a smaller county and we don't, we have less than 100 social workers within all of child welfare, and looking at how training can be rolled out, rather than just having our 1 or 5 social workers trained in MI, we decided to do a contract and have all of our social workers trained in it. And so we have done that, and we have figured out a sustainability plan so that any new social workers can be trained. But really the idea is that we haven't, the idea came out of FFPS of having social workers trained in this EBP and providing it to families through the prevention lens, but we saw the benefit of, if we equip all of our social workers with this skill, we have the ability to train everybody. Let's take that and build up these social workers so that even if they are doing other tasks within child welfare, they are still providing the same level of intervention with the EBP. So we're excited to see where that takes us, because it is something different that we haven't necessarily tried with something like MI.
I love that. And Natasha, it makes me think, when you all share a little bit, and as we think through the development of the prevention only plan, I know many people are still grappling. What does that mean, right, in practice? I know that's such a shift in some ways for many 4A agencies to think about how that might manifest with developing case management with families that are not child welfare involved, right? But through this voluntary practice. And it makes me think of just, I mean, especially in those counties, as you were mentioning, as you with a small county of being smaller and rural and the access to services, is that this is really a great way, like a stepping stone to a community pathway in the future, right? If this is a way that you can maybe build that out or see how that's going and pilot over time. And it sounds like that's how you all are kind of thinking about it too, of like, how could we continue to build upon this and see the learnings from that experience too? Thanks so much. And so I'm going to jump back to Denard to share a little bit about in San Francisco County. I know you started sharing a little bit about your pilot as well, but what are you more specifically thinking in practice with developing like the processes and the procedures and all of the things that might go into implementing your community pathway? And what are some other key factors that you are the key issues or key factors that you're considering through that process through implementation?
Yeah, so I think so our first target population is very aligned with, I believe, what's outlined in the state's plan. So our target population is very broad, and we wanted to try to capture as many families as we could. And so similar to what Natasha outlined, we have a very similar process in that the calls that come through the hotline, which are determined, as I mentioned earlier, to not warrant further investigation, we have dedicated social workers who follow up with those families before a referral to our community partner is made, because we wanted to make sure that we do have the family's consent first before with community resources. And so once that happens, then we're able to get them connected to our community partners to further engage them in those services. But we opted to hold off on, so it's right now in this pilot, we've been doing it kind of in this one-way direction where the referrals are coming only through the hotline. Ultimately, what we envision is that similar to I think what Kelly mentioned, I think it was having this more open door policy where families in need, our community partners, agencies, let them know kind of what services they're in need of, and then that community partner would submit that de-identified eligibility request or candidacy request to the child welfare agency, to us at FCS, and we would make that determination. We haven't piloted that piece just quite yet because we want to have a better sense of what the provider portal will look like and how that process will work for our community partners. But in the interim, what we've kind of focused on is building up capacity around the EBPs that we have outlined in our plan, their capacity for those, working with our community partners around the data collection and making sure that they're at least kind of getting into the practice of collecting certain data points and reporting and capturing that, as well as like the fiscal piece and making sure that our community partners and I are aligned on the fiscal aspect. So even though we haven't kind of flipped the switch on this other direction of referrals for candidacy determination, we've really used this time to kind of shore up some of the other aspects that are needed. And you asked earlier about kind of the what additional populations or issues that we're focusing on. So in doing this pilot, we've also come to understand that there are other issues that might fit into the work for strong families and communities. So we're looking at our non-court FM cases and working with our team internally to build a process to fold those into FFPS work, either while they're still open, so that would be kind of that more Title IV-E pathway combined, or once that non-court case, that voluntary case is closed, getting them connected to one of our community providers to kind of route them more through the community pathway. So we're exploring that. in seeing kind of where a lot of the evaluated out referrals that we have worked on come from, one of the things that we've noticed is most of those specific evaluated out calls are coming from our educators. So it's also given us the ability to look at how we can really target and focus our messaging around FFPS and prevention services to our community, starting with, our school system and our San Francisco Unified School District is a part of our implementation team for FFPS. And so it really has given us a lot of information on how we can kind of pivot and move and support the implementation of this project across San Francisco.
That's great. Thanks so much, Bernard. And it brings me back to, I know when we had our discussion, I love the way you framed it before of that we're going back and remodeling different
Yeah.
rooms of the house, right? We have a house. We're going back to work with our community partners to figure out what works for them, our processes working between one another. And I love the way that you frame that of really remodeling the house and different rooms in the house, right? And
Yeah,
so,
we have
yeah,
this structure in place already that is essentially, we have a foundation, we have a
yeah,
structure, and now we can, because we did this pilot, we can kind of go in and customize each room, so to speak,
yeah.
to better suit the community pathway that we're trying to build.
Great. Thanks so much, Denard. And so I think with that, I'll jump back to Natasha for Kings County to learn. I know you talked again about what you're doing internally to establish your prevention only plan, service plan. But what's the process for developing? What's your process for developing and implementing this pathway, and what are other things that you might be considering? And then I have one other question after that for you, Natasha, that came up in the chat, but I'll let you jump to that as well, if that's all right.
Yeah, so I would say we currently have a draft procedure that we worked on really over the course of this year of just, we have a small group, obviously we're a small county, and so it's myself, another manager who is over ER, so has kind of that experience, and then the social worker and the supervisor that we had identified, and along with our other management team and our CAPC, and really just discussing like what does this look like. We did decide through the asset mapping and all of the research a couple years ago that we're going to do a very small population first. So different than SF in that it is a very targeted population so that we could really roll it out. We're a smaller county, so we want to make sure, can we get this right? And then the decision, will come later. Can we broaden it? And so that was our thought process. And so with it, we do have the draft procedure kind of outlining as all of these different briefs are coming out, and me being able to participate in these different work groups, I'm able to really team with our team and kind of tweeze out like what should we have in there, what do we not need to have in there, and trying to create a clear picture so that when we do relay this information to staff, they understand. And so some of our next steps coming into this new year, very early, is we're going to roll out like a brief to all of our staff. I mean, we've been messaging to them that this is coming. We're very small. We're all in one building, so they know it's coming. But that first step of pilot of messaging out to them, really giving them an overview of what FFPS is and what it isn't. And so that way they can start having an understanding of what this option would be. And then the pilot season is going to start very early next year. The goal is to have at least 6 months, so long as CARES actually rolls out in October, before CARES rolls out, that we actually are serving families, that we have some things laid out. And then that way, when that kicks off, we can then move into the next phase of pilot. So it's kind of the long-winded process of our thoughts.
No, I love that. And I think the way that you all are thinking about sequentially rolling it out, also thinking about your target population as well as your capacity, knowing that might shift over time, right? As we get into the implementation phase, or even further into implementation of FFPS. I think there's actually one question per county that came through the chat regarding motivational interviewing. And I'm hoping you all might be able to help answer these, but one is for Natasha. if you're willing to share the MI training that you use for all of your social workers, is there a specific contract entity that maybe, or did you utilize Listen or any other kind of format that you've been able to initiate?
So for the all staff training, we did contract with our local academy, so CCTA, who did provide it, but it was through, I believe Allie and Associates was the trainer for MI. It was not Allie, but that's her agency, but they are contracted through CCTA, and then we contracted with CCTA to have them come out and do an in-person training, because that was really important to our staff. We had polled our staff really to see, like, do they prefer online training, in-person training, and they do prefer in-person. And so they did come out and do an all staff training with the foundation for the foundational, and then we did that was a 2-day training, and then the second was a advanced training, social work specific, and then an advanced training, supervisor specific. And so we did have all of our soups trained in that soup one as well.
And I think you all are exploring Listen. Is that right, Natasha? Is that something that's still being explored for you all in Kings?
We actually did enter into contract with Listen. Not for the training piece. The training we did just do for the CCTA. And so with Listen, I can't recall it. There's 2 different options you can do, or you could do a bundle, but we did the one that targets the fidelity monitoring. And so since we are smaller, we were able to get, the minimum package, and we do have a plan in place where all of our social workers that did do MI, they're also going to be participating in the fidelity monitoring. We're doing it quarterly with them. Our prevention unit will do it more frequently. But similar to what Denard said, it's like figuring it out, making sure we can collect the data, we can, do the mechanism of Listen.
Yeah.
We did very clearly outlined that we are using it for role play only, no confidential information, no real life case scenarios, nothing. We have very outlined role play activities, as well as the actor is the supervisor, so that we can make sure there's even more oversight on, that there's no way that any kind of confidential information is shared. It's truly just an interactive experience with the social worker to develop their skills.
Great. And yeah, and I think that's a perfect example too, Natasha, as folks look at the MI training requirements and then the training fact sheet. I mean, that's a pathway that folks can utilize going into it, is not having to stick with one format, right? But really adapt it and utilize Listen in any way that's going to make sense, and any other kind of platforms within your county that's going to make the most sense. Thanks so much, Natasha. And then Denard, I think there's actually 2 brief questions, if I can, that came through. And so a question came through is if MI is also being used in the San Francisco Evaluated Out pilot, if that's being utilized within.
Yes, we use motivational interviewing for our case management as well as our community providers. And we do, similar to what Natasha mentioned, the bulk of that training is being offered through our regional academy, which is Bay Area Academy. But we are also considering the state Listen contract, because it does offer some other perks that might make monitoring things like fidelity a bit easier for our staff. So we're paying attention to what's happening with the state contract, and we'll be considering joining that once more details come out. But yes, we do use MI for both case management and our substance use treatment.
Awesome. Thanks so much, Denard. And I think just the other question that came through, if I can ask, is what EBPs are the FRCs using in San Francisco County, and did they augment a current contract to include the EBP or create a new one?
So we have a number of, I think we have 8 to 10 EBPs in our plan that are being utilized in various stages through our both community partners as well as other city departments. So some of our more like mental health focused EBPs, we have our partners with our DPA, our Department of Public Health, who provide some of those more mental health services or more clinical services. Some of our community partners do have clinical providers on staff to provide some of those. And then the second part of the question is some of those services are outlined in their current contracts. So we have for our family resource centers, we partner with another city agency that kind of oversees that network of family resource centers and holds those contracts as we, the Human Services Agency, as well as another city department, contribute to those. So the services are built into those contracts that they currently provide. And we frequently meet with both the community partners as well as the other city departments to figure out if we need to make any changes or things like that. So we're in constant communication about modifications that need to happen, if any, for specifically FFPS work.
Great. Thank you so much, Tenard. And thank you both. I know we're needing to switch gears to talk a little bit about candidacy determination. And I know we'll bring you both back to drive even more in detail the candidacy determination and all that how you're approaching that. As again, I know you both are, your counties are taking very different approaches to candidacy determination, especially in relation to the pathways. But thank you both so much for talking in detail. I just love seeing all the questions and the chat going of people collaborating and thinking through and strategizing based off of hearing from you both as well. And so we will definitely circle back shortly. But with that, I am going to actually pass it over to Shavon Walker with the Department of Social Services, who will walk us through candidacy determination.
Make sure I'm off mute. Good afternoon. My name is Shavon Walker. I am a program analyst with CDSS in the Early Intervention Services Unit, and today I will be walking you through candidacy determination. Go to the next slide. So starting with the federal family eligibility and candidacy criteria, a child who is identified in a prevention plan as being at imminent risk of entering foster care, but who can remain safely in the child's home or in a kinship placement as long as services or programs specified in Section 471E1 that are necessary to prevent the entry of the child into foster care are provided. This term includes a child whose adoption or guardianship arrangement is at risk of a disruption or dissolution that would result in a foster care placement. This slide highlights the state family eligibility and candidacy criteria. So starting with the first bullet, a child described in Section 475.13 of the Federal Social Security Act and as further described in the state plan for Title IV-E prevention services and programs and approved by the United States Department of Health and Human Services Administration for Children and Families. A child may be considered at imminent risk of foster care when the county or tribal caseworker determines, based upon an assessment, that prevention services are necessary to mitigate the child's risk of entry or re-entry into foster care, and the child meets the criteria for imminent risk of foster care established in the state plan for Title IV-E prevention services and programs and approved by the United States Department of Health and Human Services Administration for Children and Family. A child shall not be a candidate for foster care while simultaneously residing in foster care. Keep in mind that this definition helped inform how counties develop their specific candidacy populations by developing their CPPs. I also want to highlight that candidacy determination is described in the state plan to create flexibility for counties to choose their own candidacy populations in connection with their service array and gap analysis. The requirements and definitions are based on meeting federal definitions and requirements and will be a part of the discussion today. Next slide, please. Let's jump into it. So candidate determination guidance. The candidacy determination guidance below was adapted from the California State Prevention Plan and does not change the candidacy definition provided there. There are 3 key factors to consider when determining candidacy. Number 1, Does the family fit within the population identified in the comprehensive prevention plan developed by the county or tribe? Number 2, does the family or child/youth qualify as a candidate based on already being in an open case or because they are experiencing challenges that make them at imminent risk of foster care entry as defined in the California State Prevention Plan? Number 3, is there an evidence-based practice in the plan that will reduce the risk of foster care entry for the family and for which the family is eligible? Please keep in mind that these 3 steps must be considered to determine eligibility for 4E funded prevention services. These steps should be considered regardless of the pathway or who is submitting the candidacy request. Please refer to the chat to access Candidacy Determination Facilitation Guide and Candidacy and Pathway Brief as resources that have specific scenarios and guidance that will be discussed today. So the next 3 slides, we're going to walk through visuals to clarify when a child or family would meet criteria and when they would not for each service plan, starting with the Title 4E Pathway, FFPS 4E Combined Services Plan. So starting in box number 1, again, those 3 questions are going to be stuck in your head at the end of today. Number 1, does the child or youth fit within the identified population served in the county or tribal CPP and qualify as a candidate because of their status in the child welfare or probation system? And put an asterisk next to this. Children and youth in these circumstances are considered at imminent risk of foster care entry without further imminent risk assessment. Expecting and parenting youth in foster care, children in non-court, voluntary, or court-ordered family maintenance cases, youth involved with probation, including those possibly subject to a 602 petition. So if the answer to that is yes, we would move on to question number 2. But if the answer was no, we can stop there because they would not be a candidate for 4E funded prevention services in this pathway. Box number 2. Is there an EBP in the county plan that meets the family's needs and for which the family is eligible? If the answer is yes, we will move on and candidacy will be established for 4E funded prevention services in this pathway. If there was no EBP in the county plan that met the family's needs or the family was not eligible, then the family would not be a candidate for 4E funded prevention services in this pathway. And again, this is for FFPS 4E Combined Services Plan under the Title 4E pathway. Next slide, please. So this visual is going to walk us through Title 4E pathway, 4E Prevention Services Only Plan. So again, starting in box number 1, does the family fit within the identified population served in the county CPP? If the answer is yes, we get to move on to question number 2. But if the answer is no, we can stop there because they are not a candidate for 4E funded prevention services in this pathway, but they can be referred to public self-sufficiency or other services in the community. Box number 2, is the family experiencing instability or are there factors that may impact their safety without provisions of prevention services? If the answer is no, surprise, you guessed it, not a candidate for 4E funded prevention services in this pathway. If they are experiencing instability, we get to move on to question number 3. Is there an EBP in the county plan that meets the family's needs and for which the family is eligible? If yes, candidacy is established for 4E funded prevention services in this pathway. If no, not a candidate, please refer to self-sufficiency or other services in the community. And for our final visual, next slide, please. It's going to be for the FFPS Community Pathway Plan. Same first question, does the family fit within the identified population served in the county or tribal CPP? If the answer is no, we can stop here, not a candidate for 4E funded prevention services in this pathway. Please refer to CalWORKS or other services in the community pathway. If the answer is yes, we move on to number 2. Is the family experiencing instability, or are there factors that may impact their safety without provisions of prevention services? If the answer is no, we can stop here, not a candidate, refer to other services in the community pathway. However, if they are experiencing instability or there are factors that may impact their safety, we move on to question number 3. Is there an EBP in the county plan that meets the family's needs and for which the family is eligible? If the answer is yes, candidacy is established for 4E funded prevention services in this pathway. If the answer is no, they are not a candidate for 4E funded prevention services in this pathway. Please refer to CalWORKS or other services in the community pathway. Next, I'm going to pass it back to Derek for a quick check-in.
Great, thanks so much, Siobhan. And just a couple things to point out, as you'll see, as you saw in those last 2 visuals, you'll see that it's a similar process, and it's similar across each of these, but specifically the prevention-only plan service plan and the community pathway services plan. They're going to be similar processes, right? But it's coming down to who's actually doing or recommending or doing the candidacy determination process based off of who will be developing and monitoring the plan with the family. So you'll start to see those connections between each of these, the pathways themselves and the service plans, as well as candidacy determination. So we do want to jump into another activity here, just to check in with y'all and get you thinking about candidacy determination and that process. So here you'll see there is a scenario where I'll read it, but feel free to take some time to review. But Maritza and Dave J have 4 children, the ages 10, 8, 3, and 2. Maritza expresses feeling overwhelmed by the stressors of parenting. Dave works overtime and is rarely available to help with parenting. Maritza feels hopeless and uncertain about how to get help for daily tasks and getting to appointments. She reported that neither she nor her children have seen a primary care provider in over a year. She also disclosed diagnoses of depression and anxiety and expressed interest in accessing mental health support. Additionally, Maritza shared concerns about her 8-year-old child, Carrie, who identifies as a boy, though he was assigned female at birth. Maritza is unsure how best to support Carrie and is seeking guidance. Dave has been resistant to acknowledging Carrie's gender identity, and Maritza has noticed Carrie showing increased frustration and sadness about his father's lack of understanding about his gender expression. Maritza and Dave were referred to the local family resource center by Carrie's teacher. So given with this information, understanding the candidacy determination process, and trying to connect it back to actually your own county or tribe's comprehensive prevention plan, and that process within the comprehensive prevention plan and candidacy determination, would this child or youth in this scenario be eligible for the FFPS program in your county or tribe? And so you have a few questions here. So yes, no, maybe you're unsure, so I don't know. Or if maybe you are working with CPP statewide and you aren't tied to a county or tribe's CPP, there are a couple options. So either you support CPP statewide but think this child or youth would be eligible or would not be eligible. So take a few moments to respond to that, see how that might relate back to your CPP, and then we'll share those results. And again, I think that this exercise here really reflects that this could be different across counties and tribes, right? Knowing that there's going to be differences between candidacy populations, as well as the ways in which the service plans get implemented. But there are different ways in considering this. And so as you complete that and you either answer yes or no to either of those, or even I don't know, maybe if you wanted to just share briefly in the chat of why yes, if there's any specific reasoning that you would say yes for this situation, or no, or if there's still things that you're unsure of that you might need to know more information about to be able to determine candidacy. So maybe there's specific factors within here that would make them eligible for FFPS. FFPS 4E funded prevention services, or maybe this wouldn't in your county or tribe make them eligible, and maybe specific factors as to why. I think we have 41% that have been able to complete so far. Right, it has slowed down. And so I think we can go ahead and stop sharing. And it looks like there is here a mix of folks mostly saying yes, that this family would be eligible for the FFPS program or for funded prevention services within their county or tribe. Curious for folks, what factors, if there's just a couple words that you can drop in the chat, what factors would make this family eligible, maybe specifically in your county or tribe? Great, I see. It depends. The county would need a mental health EBP that matched to the mom's need, and the defined candidate population would have to include one of the family's characteristics. Exactly. Thanks so much, Katie. So if there's a specific population identified in the plan, I think going through that visual, is there a tied EBP that can connect back to that service? But I think really here also just to point out is that if that is a population and there is an EBP in your county or tribe that can serve that family and meet their needs, there might be that family instability factor that might be able to be addressed within the candidacy determination process to support that family with an evidence-based program. And I see using MI to support family dialogue and problem solving around their needs. Great point, Katie. All right, well, thanks so much, everyone. And I think with that, we are going to jump on back to our county panelists here. So again, Denard and Natasha will be talking a little bit about your candidacy determination process, how you all are approaching that. And so really excited to have you both join us back for that conversation. And so I'm going to start with maybe, I know last time I think we started with San Francisco. This time I'm going to go ahead and start with Kings County. So Natasha, just have some questions. So first starting about how has your county been planning to determine candidacy for prevention services? And maybe if you want to start a little bit about talking about your candidacy population within your plan.
Yep. So our candidacy is a smaller population. It's young parents, so under the age of 25, at least one parent, with at least one child under the age of 5. And then there's evidence of domestic violence or substance use within the situation. And so we came to that through lots of focus groups, stakeholder meetings, some pulling data and seeing like what is the highest risk population in Kings County. And when we were really assessing that piece around these kiddos that are at risk of entering foster care, what population, could be served. And so that was something to consider when looking at the data. Young children were on the higher end of kiddos that get pulled into care, obviously due to risk and whatnot. So, and then in that conversation, there was other populations that were identified and they were put in, on the side. And the decision was that we would target this very small population first and then broaden it over the course of time if needed.
Awesome. Thanks so much, Natasha. And so it sounds like, yeah, you all have that really starting to make sure that those at what is being informed by data within your county to determine who can we start with and then expand over time, really to support those families and other families that might come across and might be looking for those voluntary support services. Thanks so much. And so same question to you, Denard. I mean, how are you all I know, again, going back to, I know you all have a more expansive candidacy population within San Francisco County. And so how has your county been planning for that candidacy determination, determining candidacy for prevention services?
Yeah, so we've been utilizing the 14 population target population categories. And we, as we've kind of built this out, we've come across some additional populations that we are considering on how to fold into this work. We explored several options in terms of the candidacy determination assessment tool. We went back and forth. I think that was one of our kind of initial hurdles, and as I would guess for a lot of counties, on how to build that out, what tools we were using, whether, we were relying on traditional child welfare assessments versus creating something brand new. I think some of the conversations that we've had in our like 4E subcommittees, as well as some of the guidance that we've gotten from CDSS, indicated, that we wanted to try to, one, stay away from traditional child welfare tools, but then also keeping in line with wanting to maintain that separation of the child welfare side of things, for us, with the community side of things, and wanting to make sure that we weren't bringing families into the child welfare system that were not already there. So we initially considered things like, as part of our candidacy determination, recent SDM scores, things like that. Ultimately, again, with getting that guidance from CDSS team, we created a tool that basically identifies certain risk factors. We have several risk factor categories that we listed out for our social workers to consider, as well as looking at like strengths and needs. And so one of the things that we do is, so even though a call may come through the hotline for a specific allegation, and we think, okay, this family could benefit from one of our EBPs, either in parenting support, mental health, or substance use, we also recognize that that might not necessarily be the primary reason that the family feels that they want to address. And so, in doing our candidacy determination, we also collect information about, other areas of, or other services or assistance that the family feels that they might need. And we do that because we are utilizing our existing community infrastructure. We are able to address the necessary EVP, right, which satisfies the FFPS requirement. But our community partners also have the fundings to address other needs, right? More concrete needs. So we think it's very unlikely that a family will continue, going to parenting support classes if the primary focus is how to keep a roof over their head or how to keep food on their table, right? So some of our community partners are able to address some of those more concrete needs also, and create a more holistic plan that addresses both the required EBP services, but also that is able to get at a bit more what the family might feel is a priority for them. And so all of that is captured in our assessment tool that we created. And then the last part of that is we also just check to see, when that call comes through the hotline, we check to see if there's any current either any open cases or open referrals, or if there has been any open referrals or referrals within the last year, because that could potentially increase that imminent risk, depending on, what the allegations were and the results of those. So we kind of look at all of that initially just to see if this is something that we should forward to our community pathway, or if there's a bit more going on that might warrant some further investigation on the child welfare side.
Great, thanks so much, Denard. And it sounds like and that's really through your pilot that you're doing internally, right? Sure. That you're looking through, and it sounds like that over time, the idea, especially knowing that there might be different avenues in which a family gets connected to these services and supports and 4E funded services, right, in the community. So again, going back to that no interaction with child welfare, they might be entering into a family resource center to receive that. So it sounds like you all are developing some kind of tool for your county that could really be adapted with your community partners to be able to do that risk assessment or risk screening for being able to determine candidacy.
Correct. And we developed it in collaboration with our community partners.
That's great.
For instance, so one of the elements that we included in our service needs and assessments portion of that, we adapted from the Family Assessment Form, which is a tool that many of our community partners currently use as part of their case management. And so we wanted to try to make this process as seamless as possible for all of our stakeholders. And that was one way for us to do that. And so even with the current internal pilot we're doing, that information was incorporated in collaboration with our community partners.
That's great. And just want to point to also just, I know that you had mentioned, that it's they might be maybe coming to the attention of your agency and might have needs that maybe that evidence-based program is not their priority at that given moment, right? And there's maybe other services and support. So I just really appreciate that. Yeah, just you bringing up that specific focus, because that's really the spirit of the community pathway, right? And how we're approaching that and identifying that it's not always tied to that specific service, but knowing that there's this funding to support those families with this extra service in addition to any concrete support needs or anything.
Absolutely.
Which is
Yeah,
great.
we want families to get the services they need in order to support the prevention, but we also want to make sure families, as best we can, have the support that they need in order to prevent that reentry also for cases of families who have been involved. And so being able to take a more holistic approach and address both the EBP service as well as issues that the family might feel are more of a priority for them really helps us to do that.
Great, thanks so much. And Natasha, going back to talk about your approach to both, I think the combined service plan and the prevention only service plan, and thinking a little bit more in depth about where you're at in developing those specific processes. So I think that's part of the next question here is where you are in developing those specific processes and what do you envision those looking like in practice? I know you talked a little bit about how you anticipate that, some of that, how that's going to be referred through if there's maybe a referral through the hotline, right? But is there anything else you might want to point to that how you all are thinking about developing that process, especially, and then, connecting with any community-based providers through that process as well?
Yeah, so I mean, we have a similar stance as Jannard was explaining in that, it will come, initially it's going to come through an investigation or a call through the hotline. That's the way our county is laid out, because we are so rural, people call the hotline for everything. And especially since we're centrally located, like our CalWorks office, everything's in the same building. And it's actually, there's one line that you can call and click this number for CalWorks or child welfare. And from my understanding, when you click like 0, it goes straight to child welfare or something like that, because we get so many calls where they're having to triage, and our screeners have to have a little cheat sheet on like who they actually need to send them to. And so we know we will be getting, primarily the most calls. And so the idea is that it would be triggered through our hotline. If there is an investigation, that's the most black and white way to know whether or not this child's at risk of entering foster care. And so in that pathway, there may be situations where an investigation occurs and we've substantiated, but we're going to close it out, which is that FFPS, the vision of it, because that's not primarily how we do things now. And so we would close it out, refer it to this prevention unit, who would then not only look at what allegations actually occurred, but the underlying concerns. With our candidacy, it's young parents with young children. So, I mean, we all know the challenges that just comes with by nature. And so connecting them with some services within our community, which we do have, like First Five. It just may not have the capacity to be able to serve, so many people, but we do have that resource in our community. And linking them, we have a pretty good linkages program where through court, we do a coordinated case plan and whatnot. So the idea is that our prevention worker would also team if the family's linkage is eligible, having that same spirit of a coordinated case plan. If they have, a CalWorks plan already in place, okay, let's not create more work for them. Let's build off of that and have just one plan for this family. And really looking at their concrete supports, what do they need? Because the goal is that if abuse has occurred and this child is at risk of entering foster care and they do meet our candidacy, and motivational interviewing could help support them, that we can not only address the abuse, but also address any underlying concerns. And looking at such a young population, the goal is long-term, right? We have the chance to do some prevention with this family who may have been in a cycle of abuse and, they're young parents, and we may be able to stop this cycle by putting in some of those supports that we may not have been able to before. I think
Yeah,
you
and
had the question around how we're going to assess as well. And so because we're going that pathway, risk, we're going to use the SDM risk assessment initially. There are, criteria on there around concrete supports, housing and whatnot. So we are trying to figure out if there's other non-child welfare tools to use. So we were definitely open to that. But initially, because we know the tool, we know how to use the tool, we know that it's a tool and you still have to do the assessment piece with it. And our workers are trained in that and they know that it's not black and white. So I think we have the capacity to be able to make sure that even if it says low risk and we know there's other concerns going on or vice versa, that we can use our critical thinking to build off that tool.
Yeah, and Natasha, you said something a moment ago about just the services in the community, and it brings me back to a question I think somebody had posed earlier about, if you're going through this 4A combined or prevention only service plan, does that mean that community providers are not integrated into that, whether it's through contracting or coordination? And I think that you have just highlighted for that they're still involved, right? There's still this involvement, there's still this contracting process or engagement with those providers, and also knowing that's part of the CPP process, right? But I want to highlight that, since that is a question that came through, that there's still, I think for counties, knowing that might be limited, right? Knowing based off of resources that may be limited in the community, but there is still this community involvement through the process to provide those specific services. And so I bring that, I'm not sure if you have anything to add to that, but I just wanted to reflect that's, I'm just so glad you brought that up to highlight. And I'm not sure, Natasha, through this process too, if you all have those contracts that you're setting up with those community-based providers for the services.
Yeah, definitely. Within our plan, we had outlined that, so previously, like our parenting contract, they were only court ordered. And so when we, put in an RFP, found a different vendor, really thought around what would best serve like all of our populations, what curriculum could be more tailored to each family. And so we went with Triple P, and within that contract, we did put in that it can be voluntary services as well. It does not have to be only court, and really outlined in there to ensure that the funding was available to serve that population. So any resources in our community, if they're going to serve this population, we're going to try to link them. But we do also see that services aren't always the cure, like the fix. So the fact of having a social worker who, yes, is in child welfare, but we are going to really try to make sure that we shift the vision or the outlook of what a child welfare social worker is, and make sure that the family knows, like, this worker is really walking alongside of you. MI doesn't just have to happen with the parent. It's working with the kids. It's working with the family, the support network, and like the whole vision of it. And so that's kind of the bigger picture of MI, and then all of the resources and the services that the family feels they'll benefit from them then of course we'll refer them, but we don't want to overburden these families with a bunch of services when really it's just they need some guidance, they need direction, they need help, pulling their team together and help holding them accountable to, really make these changes that they identify that they want to make.
Great. Yeah, that's great. Thanks so much, Natasha. And just appreciate you sharing a little bit about your assessment process to knowing that, SDM, is really going to be falling within that combined service only plan pathway, right? And I love that you lifted up too, that you all are exploring these different options for especially those families that are joining you all voluntarily, to, within that prevention only service plan, to be able to identify things, I guess, before beyond traditional child welfare practices, right? To explore how we can engage them in these services and supports. And so thank you both. I'm going to jump to back to Denard. I do have a question here I know that you all had mentioned too that you are exploring populations beyond what you've already included in your plan based off what you're learning as well. And so I'd love to hear a little bit about what with that and in regards to that specifically, but also what aspects of candidacy determination is your county still exploring?
Yeah, so as we've kind of been working through this, and because we have such a diverse implementation team of representation of both community agencies as well as other city departments, new things come up that we didn't necessarily consider initially. And so recently we've been looking at, I think one of the issues that our San Francisco Unified School District partners brought up as a potential issue to consider is students who are at risk of medical neglect, who have diagnoses like diabetes or things like that, who aren't either consistently taking their medications or aren't able to get their medications or whatever the case is. So that was brought up as something that we are looking at, if there's a way for us to address that through our Strong Families and Communities pathway. Substance exposed newborns is one of the 14 target candidacy populations, but it's not something that we've addressed through this internal pilot we're doing, that there's interest in looking at. Like I said, I mentioned earlier, the non-core FM cases were not a part of the initial internal pilot that we launched, but we are looking at how to fold those into this community pathway for Strong Families also. So it is a evolving process. And a lot of that too is centered around as we, continue to get guidance and updated briefs from you all at CFPIC in collaboration with the CDSS team. And one of the kind of larger factors too that we're looking for is having a better sense of what I think I mentioned earlier, the provider portal will require our community partners to document, submit, things like that, so that we can then figure out how to tailor a bit more of this information and a bit more of this process. Tied also to, we are preparing for CPP renewals. I think ours is early next year sometime. And so we're also looking at, are there additional EBPs that we want to include that were not included the first time and potentially get included into the state's plan. So yeah, it's an ongoing kind of evolution. Our assessment tool, like I mentioned, went through several iterations before we got it to where it is now. And I wanted to highlight too, so I mentioned that we initially considered using things like the SDM and one of the things we realized, and this is, I think, a great way to highlight the community pathway versus that prevention only pathway that Natasha and Kings County are looking at, because we are utilizing our community network and SDM score. Once we get to the point where we are getting referrals from the community partners for us to just determine candidacy, right? Some of that information around SDM is going to be info that the community provider isn't going to have access to. right? Unless they were involved or had access to the child welfare systems, which we don't necessarily want. And so that was part of the reason why we decided it would have worked for this pilot because we're only looking at, calls coming through the hotline, but thinking long term, it wouldn't have been a viable solution for us. So that's part of the reason why we determined like that specifically wouldn't work for us. But a county who's doing the 4E prevention or the prevention only pathway, that might make more sense, as Natasha outlined. So yeah, it's an evolving process both through the assessment tool as well as our CPP that we're looking at making potential revisions to.
Great. Thanks so much, Denard. And I just wanted to, I know we're getting close to the end here, but I just wanted to end on one last question. And just one, if you can identify one thing that you think other counties should consider when planning their own candidacy determination process, if you could just briefly, if each of you don't mind sharing just one thing that you might consider others or encourage others to consider. And maybe start, Denard, if you have. I saw you thinking,
Yeah, like,
maybe, or we could pass over to Natasha first if you want.
I don't know. One thing might be difficult, Derek.
Okay. I know there's so much, right?
Yeah, I don't know. I might have to think about that for a second.
Sure.
I can go first
Go
because
ahead,
I had thought about it prior. So I think so, when you're talking about data, it gets very blurry because we want to be data driven, like we want to know, but we also don't want to be driven by data. And so when we were looking at all of it, really look at your data, because a lot of times we think anecdotally that we know the highest risk population. And then when you really look at the numbers, you see, oh, you're wrong. And so really having like a combined, I guess, thought on it yes, look at data and see that should spell out the populations that could best be served through this. And then also considering, what are families saying? What are they see needs, which may not be outlined in the data. So just kind of the whole picture.
I think that's a great point, Natasha. Similarly, I would say if you are a county that is building a community pathway, make sure that you are collaborating with your community partners on those populations that you're looking to serve. Because whether you are the child welfare agency or the probation agency, you might be, as the 4E agency, you might be coming into contact with different populations than your community partners might see. And if there's a way to capture, those families also that are already presenting to the community agencies, that would only benefit your implementation in your program, I think.
Thank you so much. And I hope I can ask Natasha one last question regarding Listen, the use of Listen in your county, I think came through. Is because I know you're using the QI platform, right, for the quality improvement. And so how there was a question that came in as how many people were on that, or how many seats did you have for that specifically for that QI platform, if you know off the top of your head?
Yes, so the minimum seats that the contract would allow would be 100, and so we don't quite use 100. However, we saw that the cost was okay for what we're wanting to get out of it, and so even though we're not using every single seat per se, we felt like it would benefit our staff to have that.
Great. Awesome. Thanks. Just wanted to close the loop on that one question that came through, but thank you, Natasha. Thank you, Denard. Thank you both so much. Really appreciate it. And your partnership through this process on the 4E Advisory Subcommittee and being able to join us. I know I'm just seeing in the chat and through the questions that folks are learning a lot from just how you all are thinking ahead of the game with regards to planning this out. And I think the big thing you all take, that I take from this discussion too, is get to planning, right? To get to thinking through your planning process, because if we wait for the planning process, it's going to take longer and longer, right, to get to implementation. So just appreciate both of you sharing your time and your expertise and experiences with us.
Absolutely. Thanks for having us.
Thank you. Great. I know we're running a little bit behind. We have 8 minutes left, but I wanted to just close us on out with some next steps, including getting involved, sharing progress. So as I had just mentioned as well, that Natasha and Denard are on the 4A Advisory Subcommittee, which is a subcommittee for all of those CPP leads, directors within those agencies for tribes of 4A agreements, probation agencies, and child welfare. If you are a CPP lead or a director within those agencies, you'd like to join that group, please reach out to myself or anyone from the CFPIC team or even CDSS. We can get you added to that group. If you are interested in joining the Community Pathway Advisory Subcommittee, we are always accepting applications for that subcommittee. We will drop in the chat as well the link to be able to apply. We'll keep your application on file. We currently have our max capacity with those on the committee, but folks do transition and shift over time. And so we will also have that on our webpage when we have vacancies that open up. And then what's coming next? So I want to make sure we can touch on what can you all expect going forward. And one of those being, when's our next FFPS Town Hall? We do have that scheduled for June 18th, which is a Thursday. And I'm sorry, this says 2025, and that should be 2026. But since that passed many months ago, but we will have our next one on June 18th of 2026 from 1 to 3, and we will have the flyer coming soon so that folks can share that out and be able to register for that as well. But I am dropping in the meantime the link to register for the FFPS Town Hall in the summer if you'd like to get started on getting that on your calendar. And then there are a few other updates. One of those being, I know we talked a lot about motivational interviewing today and listen specifically. And so I just wanted to share a little bit, and I will let also the CDSS team jump in if they wanted to add anything, but just sharing that CDSS is currently moving forward with contracting for 10,000 seats for Listen. They're working on finalizing the scope of work along with the Listen team and moving all of those necessary documents through the CDSS contract pipeline. Which will take some time, but they are also hammering out some of the details of how the seats will be allocated to counties, tribes, and all of the probation partners. So there will be some more to come as details are finalized. So I'll let CDSS jump in the chat or interrupt me if they wanted to jump in and clarify anything, but that is next steps for that statewide contract. There is a family wellbeing plan implementation brief that's coming out as well. So that is in development with the Community Pathway Advisory Subcommittee, clarifying all of the details and what considerations and requirements folks should be aware of as they develop family wellbeing plans with families and as they get ramping up for that implementation of those. So that should be coming out in the coming weeks. Hoping folks, if you join any of our advisories, you'll definitely have a part in being able to give input and feedback within that brief itself. And then last but not least, there is some EBP CQI contract guidance that I know the Chapin Hall team, alongside the CQI subcommittee of the FFPS advisory subcommittee, the FFPS advisory committee structure, that they've been developing to help give some guidance as folks go into their contracting. We know that takes time to contract. And so that is in development so that folks know what are the data requirements, what are the CQI requirements as part of FFPS, and how do we actually embed that within the contracting process so that providers are in the know as well as our other local partners are in the know of what the expectations are for that. And with about 4 minutes here to spare, I am just wanted to close out with, if folks still have any questions that they want to drop into the Q&A, any thoughts, any additional feedback or just reflections, feel free to drop that in the chat. And I am actually going to provide, if folks want to take out their phone, scan that QR code, you can provide a brief feedback on a brief survey there on today's town hall. And we are also dropping the link to that in the chat if you'd like to be able to give any feedback to anything else you'd also like to hear about in a future town hall meeting. And great, thank you, Katie. Patty, thank you. Are the slides going to be shared? Yes, we will have those, all of this material, the recording itself, will be available on the CFPIC webpage in the coming days. And so we will get that shared out with all of the registrants for this, and we will make sure that is also shared out in the CPP Spotlight if you are connected to that. But you can also get subscribed to that on our webpage as well. Thank you all so much. I'll defer to anyone else on our planning or our great CDSS partners if there's any other final remarks you'd like to share. But otherwise, I hope everybody has a great rest of their day and their week. And thank you all so much.